Follicular unit extraction is the latest hair transplant technique used in Turkey and worldwide. It's an innovative method leading to positive, natural results in both hair extraction and transplant. Mehmet Güçlü, a specialist in the European Hair Transplant Center in Istanbul, Turkey, will talk to us about the FOI technique and give us more information about it. We apply in our operations the latest hair transplant technology system, in which you pick out follicular units. These operations are evidently achieved in sterilized conditions. For each patient, we use different punch knife. Depending on the structure and thickness of the hair, these punch knives are disposable and usually measure about 0.6 millimeters.
Is the hair transplant operation accustomed to each individual?
Yes, indeed, the operation is accustomed to each patient individually, and we use a special punch knife on each individual. As each person have different front line and hair structure, we also operate according to each person's facial features and hair structure. That's why it is accustomed to individuals.
What are the steps that the person willing to have a hair transplant have to go through?
First of all, during the pre-interview, detailed briefing on the subject is given to the patient. After providing all the information for both of the parties and agreed on for the operation, we fix the date. At the day of the operation, firstly, patient's hair will be shortened with haircut machine. Then from the donor region, in the area where is located, we take healthy hair follicles one by one, with the aid of micromotor and special tips. Upon completion of the first phase, we apply local anesthesia to the marked region. Then the transplant process will be finalized, taking care of the front location to have an aesthetic and entirely natural appearance. Absolutely, now we are far ahead in the world and Europe. For instance, we are receiving patients from Qatar, Mecca, Dubai. The main reason for that is because of having natural and good-looking results. If to ask how we succeed, we attach hair follicles to the front section one by one, and then we arrange the direction and slope of the hair as close as possible to the innate state by implanting hair at an angle of 45 degrees. As a result, having the new hair with a natural appearance.
What do you advise a patient looking for the right hair transplant center?
First of all, patients willing to have hair transplant have to consider whether it is done under clinical conditions or not. It has to be done under sterile conditions in a hospital and in an operation room. The first term to be considered is this. Secondly, references of the expert on how long he has been doing these operations, the quantity of his monthly cases, and the records of his previous patients should be taken into consideration.
Assuming that a patient decided to have a hair transplant operation, then he gets his hair shaved. How long does the operation last, and does he feel any pain during the operation or afterwards? Can patients who had hair transplant before and are not satisfied with the result have the opportunity in a second operation to improve their hair?
Of course, we have patients who had bad operations in other centers and not satisfied. We apply procedures to increase the intensity and hide the improper image. But the donor region need to be appropriate for that purpose. My name is Mehmet Şahin and I'm 28 years old. I am an executive assistant. I came to Mehmet Güçlü for hair transplant because I trust him very much. Mr. Mehmet will definitely have very nice new hair at the end. He already has a natural line. His hair loss is very convenient for hair transplant. An average of 2,500 grafts are coming, which is approximately 7,500 to 8,000 hair fibers. After 6 to 8 months of his hair transplant, he will be able to use his hair as he desires.
Previously, you have realized Mr. Mehmet's hair transplant surgery. He seems to have an extremely natural and lush new hair. As the person who has done the transplant, what would you like to say?
We had applied Foy technique to Mr. Mehmet under surgery room conditions, and approximately 2,500 grafts, which is equal to 7,500 hair fibers, were transplanted. Within a week time, his operation scars have mostly disappeared, and now, as you can see, he has a good look and appearance. Then within a period of 15 days to 2 months, the transplanted hair will fall, and within 6 to 8 months, new hair will start to come out.
We were together during the whole process of your surgery. What were the experiences you have faced after the hair transplant?
My daily life is significantly changed. The day after the operation, everybody was shocked because I had not informed anybody on hair transplant issue. The post-operation night, I had difficulties in my sleeping and I took extra care. I had obeyed all the advices. Healing took a week time. Wound scabs were completely fallen in my scalp. I took positive feedbacks, especially in my office.
You have mentioned that you did not inform your family and friends. What was their reaction when they first saw you?
My mother asked me to go and see the doctor 3 years earlier. She did not expect that kind of natural appearance. She had hesitations about the result. My boss also liked and told me I look younger. I received no negative complaints so far. I can now discuss with my friends which hairstyle suits me more.